Thank you to Steve Horwitz for inviting me to share my research. Thank you to the faculty and staff at Ball State University for taking the time to listen. I look forward to the live Q&A. The paper I want to share with you is joint work with Corey DeAngelis. He's the director of school choice at the Reason Foundation. And the paper grew out of a discussion Corey and I were having about school shootings. There had been yet another school shooting at a public school, and it seemed, anecdotally at least, that many of these school shootings that have appeared on the news in the recent history have occurred at traditional public schools. So Corey and I were chatting about the role of mental health, about how schools impact mental health, and as you might expect to have happen when researchers start asking questions amongst themselves, it led to us deciding to conduct some research to determine whether and how school choice affects mental health. So in fact, the title of this paper fairly accurately describes what we're going to be talking about today, which is how and whether school choice affects mental health. Adolescent mental health has declined in recent years. One measure of that is we look at the number of suicides among adolescents, among 15 to 19-year-olds. So these are deaths by suicides among 15 to 19-year-olds across the whole United States. And you can see after a long period of decline in the 1990s that more recent history has demonstrated a large increase in the number of suicides among adolescents. Death by suicide is highly correlated with mental health disorders. Most people, perhaps as many as 90% of those who die by suicide, suffer from a mental disorder, and adverse childhood experiences, events such as child abuse and bullying in schools, are a risk factor for suicide death. Children spend a large fraction of their time in school, and their interactions with their peers and their teachers affect their mental health. We observe prior research that validates this view. There's a couple papers that examine the seasonality and the timing of suicides among young people, and there's strong evidence that children's mental health is better when school is out of session, both from economists, as in the paper by Hansen and Lang, and from medical researchers, as in the paper by Clemens et al. To the extent that stress at school that's worsening mental health stems from things like bullying and other abusive peer interactions at school, these behaviors are less likely at private schools. There's a variety of papers that documents better behavior among students who are enrolled at private schools. So why might school choice play a role? So first, let me start by describing what we mean by school choice. So the vast majority of students for most of the last many decades have attended public school, a traditional public school, where the traditional public school that you are allowed to attend is determined by your residence. So when a family chooses a house or an apartment in which to live, they are also choosing as part of that residential bundle the traditional public school that their child is eligible to attend. In some cities, when you're choosing a house based on your job, you might have a wide variety of school districts from which to choose, but you're making that choice and balancing trade-offs between commuting, community amenities, and the school that your child or children may be allowed to enroll in. Beginning in roughly the early 1990s, lots of states began adopting charter school laws. Charter schools are publicly funded but privately run schools that typically children who live nearby, although there are less residential restrictions than traditional public schools, are eligible to attend. So charter schools provide another schooling option that has no out-of-pocket cost for families because they are publicly funded. A more limited set of states and cities have adopted voucher programs. School vouchers are programs that that provide families typically with about half of the funding allocated to educate children in that state. Typically the state half of the funding is provided to the families to spend on educational services. Those educational services can include tuition at private schools. In many cases, these voucher programs are limited. They're based on on some eligibility restrictions. It's not uncommon for voucher programs to be means tested and only available to lower income families. It's also not uncommon for voucher programs to be restricted only to those students who are on an individualized educational plan, an IEP, students who have special needs. Effectively, what voucher programs do is by providing funding to families for their children instead of to schools for the students who are educated in that school, they're provided to the families who are raising those children. It lowers the cost of sending your child to private school. So sort of as part of what's happening with voucher programs is it's lowering that out-of-pocket expense for families to send their children to private schools. Okay, so how might school choice affect mental health? I'm going to talk about 4 potential mechanisms. I'm sure there are possibly others, but these are the ones we're going to focus on. For one aspect of what school choice does is it allows students to move to better schools. Almost all research shows that schools of choice, charter schools, private schools, are at least as good or better in terms of academic outcomes and non-academic outcomes than nearby traditional public schools. Better, you put it in quotes, better may be academic or non-academic. Parents care about both of those things. And it may be the case that charter schools and private schools, due to the flexibility afforded by being privately run, can focus on other outcomes that are important to families. Perhaps, for example, private schools may focus more on activities that improve children's mental health. Another aspect of school choice is that it increases the competition for students and the funding that follows the child. Competitive pressures improve schools, not just the schools of choice, but also the traditional public schools. Almost all research looking at how school choice programs affect traditional public schools shows that traditional public schools are at least as well off or better than they were prior to school choice programs. Because traditional public schools funding is determined by enrollment, increased competition leads public schools to operate in ways that make those schools more attractive to families, improving both academic and non-academic outcomes. Relatedly to both of these first 2 points, more choices allows families to find a school that better fits their child. So a great school may not be great for every child. Different schools might be better for different children. Even without any improvement in quality, having more choices allows families to better sort into schools that fit their priorities in terms of academics and non-academics, in terms of the support for their children, and an environment that fits their family needs. Better fit allows the students to flourish. It also, perhaps importantly for the application we're considering here, school choice may act as an escape valve. Large fractions of children experience or participate in bullying at school, roughly 35% in one survey, with 15% involved in cyberbullying. Having affordable options available to families provides an escape valve when students cannot or will not when schools cannot or will not adequately address bullying in their schools. Previous research suggests some of these mechanisms. We observe lower rates of crime and disciplinary incidents in places with more school choice. A couple of studies, the paper by Watt and the paper by Mojan and Tekin, compare mental health in traditional public schools and in private schools, observing the same or possibly improved mental health among those enrolled in private schools. We may be concerned, and we'll talk more about this as we go, we may be concerned that private schools are better able to screen students out with poor mental health. Mojan and Tekin use propensity score matching to address this selection concern and find that Catholic school attendance has no effect or possibly reduces attempted suicide. So we have some evidence in the literature supporting a relationship between school choice and mental health outcomes. We're going to ask two questions. How do voucher and charter school laws affect state-level adolescent suicide rates? And do students in private schools experience better mental health outcomes? I'm going to start with the first. How do voucher and charter school laws affect state-level adolescent suicide rates? So we're first going to consider this one measure of adolescent mental health, which are the number of deaths by suicide in a given state. We're going to estimate the effect of states' adoption of charter school laws and voucher school programs on adolescent suicides. So our outcome variable here is going to be the number of state-level deaths of people aged 15 to 19-year-olds due to self-inflicted harm from the Center for Disease Control's National Center for Health Statistics. And we're estimating this in a standard difference in differences framework. I'm going to consider three different laws. We're going to consider charter school laws, whether the state or a city within the state has adopted a voucher program, and separately we will consider whether the state or a city within the state has adopted a voucher program solely for those students with an IEP, special needs students. For those of us who may be less familiar with differences in differences, I'm going to spend a little bit of time describing what we're doing. Okay. So if we look at the average number of suicides among 15 to 19-year-olds, and I'm going to compare, this table is comparing the rates of suicides or the count of suicides among those never adopting each of these state laws or state programs, and among those ever adopting any of these school choice programs. And the first thing to note, if you look in the column that says never, that suicides are higher among states never adopting a voucher program than if you look in the column that says ever, all suicide counts are lower in those states that have ever adopted a school choice program. So we see 43 suicides on average in a never adopting a voucher state. We see 37.56 suicides on average among those states ever adopting a voucher program. So there's some pre-existing differences, for example, in the level counts of suicides among states that will and will not adopt voucher programs. Similarly, we see similar differences for those with vouchers for IEP students only and for those states who adopt charter school laws. There's some baseline differences. And part of what difference in differences is going to allow us to do is to account for some of those differences. Effectively, if we think about estimating difference in differences for one particular law, or in this case, we're going to think about that law as a treatment. So adopting, for example, a charter school law is treating that state by opening more school choice options for families. So we can think about there being two groups of states, the never adopters and the ever adopters. Okay? And the never adopters are going to be the blue line on this graph. Okay? During the time period, if we're comparing two states, one that never adopts a charter school law and one that does adopt a charter school law, there's a change over time in adolescent suicides. We see that trend nationally that likely is occurring for a variety of reasons across the country. So we want to account for the fact that there's a change in trend over time, and difference in differences allows us to do that. What we're really asking with difference in differences is something like, did those states that adopt a charter school law have a greater than expected change in suicides post-adoption? And differences, so the adopting states are going to be the red line in our graph here. And the difference that we're estimating is D. Both the blue state, the not treated, the control state, or the non-treating state, treated state, and the red state, the treated state, both of them see a change from the pre-period to the post-period. That's C. And both of them started in different places, and that's fine too. Difference in differences is going to allow for the fact that on average the number of suicides differs across states, and we're going to control for that instead of allocating that difference to ascribing that difference to the charter school law or to the voucher law. So what we're thinking about is, given that they started at different places, did they experience the same change pre and post adoption of the law? And if not, what's that difference? The difference in difference estimation effect is calculating this average difference across a variety of states as they adopt their school choice laws at different points in time. And our favorite, holding everything else constant. So ceteris paribus, we're going to do that trend differential over time, holding a bunch of stuff constant. What are we going to hold constant? We're going to hold constant a variety of factors that previous research has suggested is correlated with adolescent suicide. So that includes some economic conditions, the percent of the population in poverty, the unemployment rate, per capita income, some demographics. We know that there are differences in suicide rates by race. We're also going to include the percent of the population aged 15 to 19, and a variety of laws that affect substance use, both among young people and among older people, as we know that substance use is also correlated with suicide rates. To give you a sense of how the state's timing is happening, this graph is showing you the number of states who have adopted each of these laws. I'm going to start with the green line, which is the charter school law. So you can see, starting in the early 90s, we see that initial adoption of charter school laws. There's bunches of states passing charter school laws in the late 1990s. That increase has slowed, but we're up to the majority of states in the U.S. have some mechanism by which a charter school can open. Vouchers are occurring much later. So we have some states that have had a voucher in place for an extended period of time. So there are always adopters in our sample. And then we have additional states who are bringing their voucher programs on, and cities who are bringing their voucher programs online during the more recent past. So many of these are happening in the early part of the 2000s, and we see that increase in count. Because, yeah, great. And there's a smaller number of states who have adopted voucher programs that are specific to IEPs, but those have happened as well. Okay. So we're going to estimate the effect of these laws using a fairly traditional difference in differences estimation. We're also going to allow the effect of the law to change over time in some specifications, in part because we might think that a supply response to these laws takes some time. So a state might adopt a charter school legislation, but it takes a few years or a limited period of time at least for new charter school administrators to apply for a charter, to open their school, for additional ones to observe the marketplace and respond to changes in demand. So we may expect for there to be different effects of these laws as schools and school administrators have more time to change the seats they're offering or the schools that are available in response to the laws. The overall picture that we observe, we can kind of see in this table of difference and differences estimates. As we go from left to right, we're adding more controls. And then in the very last column, in column 6, I'm allowing some variables that allow the effect of these laws to change the more years the law has been in place. The overwhelming effect that we observe here is that states that adopt charter school laws see declines in adolescent suicides. Generally, the effect of voucher programs is negative It's never statistically significant. It's smaller. The voucher programs for IEPs, the coefficients are more mixed, and again, rarely significant unless we control for a limit, basically nothing. It's not surprising to me that the effects of charter schools are bigger than the effects of the other programs. There's significantly more students who are enrolled in charter schools than are enrolled in voucher programs, on the order of at least 10 times more students enrolled in charter schools than in voucher programs. So we might expect charter school laws to have larger effects. And the magnitude here is that we're roughly seeing 3 to 4 fewer suicides a year in states that adopt charter schools. If we estimate it, because we're using a count, if we estimate using a negative binomial, the results are similar. And these tables do not include Alaska or Hawaii, although they do include the District of Columbia. When we look at event study specifications, again, that charter school law effect is robust. So I'm very confident in being able to say that adopting a charter school law has led to reductions in adolescent suicide. In some specifications, we see declines following voucher laws, but that result is not robust to specifications, and I would be less confident in claiming an effect there. The second question we're going to ask, and related question we're going to ask, is do students in private schools experience better mental health outcomes? We use data from the 1997-1998 cohort of the National Longitudinal Survey of Youth, NLSY, provided publicly by the U.S. Bureau of Labor Statistics. And the model we're going to use, it's a cross-sectional model, so we're going to observe each respondent, each person in the sample, using data from a variety of years. We're measuring, the NLSY measures mental health when these respondents, when the survey participants are in their late 20s and early 30s, so as adults. But we're going to measure their private school enrollment much earlier in their lives. And we're going to control for their mental health at a pre-existing point in time. So again, it's not ideal, as I mentioned when we were talking about the Mojon and Tekin paper. One of the concerns we might have when we're comparing outcomes for students who are in private school versus students who are in traditional public schools is that there may be sorting based on family characteristics, or there may be screening based on, from the school's perspective, based even on mental health outcomes. And so we're a little concerned that we don't want to attribute different pre-existing differences in adolescent and underlying mental health to the school attended if that's just reflective of sorting. We address this in a variety of ways. We address this by controlling for a wide variety of family characteristics, and we address this by controlling for a pre-existing mental health score. We're going to measure private school attendance in 1997. So this is typically when the respondents are in their teens. And then we're observing their mental health. The first time the survey reports on something that we can use as an index of mental health is in 2000, so 3 years after we've observed whether they attended private school. So if anything, we're probably controlling away some of the effect of the school, because not all of them are going to continue. They're attending fewer years of school after we've observed their mental health. But our estimates are robust to including or not including that mental health score, and we include it as a way to account for any pre-existing differences in mental health across those students who attend private versus traditional public schools. We examine 2 mental health outcomes. So we observe the number of times they've been treated for a mental health disorder is self-reported in 2011. Again, typically when these respondents are in their late 20s. And then 2 years later, they're also asked explicitly whether they have a mental health disorder. Again, it's self-reported in 2013, so in their late 20s, early 30s. You can see there's average differences. Certainly the average difference is significantly higher for those respondents enrolled in public school in 1997 than for those respondents enrolled in private school in 1997. To attribute that to any sort of causal mechanism, we need to think about how or account for any differences and underlying differences across these types of students. When we include, so we're going to include a variety of factors: the sex of the respondent, their parental education, their age, how big their household is, their ethnicity, whether they're foreign born or not, whether they live in a metropolitan area, or how big of a metropolitan area, and what census region, what 4-level census region they live in. So we're going to account for some regional differences as well. And typically what we observe is that those respondents who attended private school as teenagers report lower rates of mental health disorders as adults and fewer numbers of times treated as adults. These magnitudes are fairly large. If we look at the magnitude of the number of times treated last year, for example, we observe averages that are fairly small, and yet we see economically large and statistically significantly negative effects of attending private schools on the number of times treated. Similarly, with whether or not they report having a mental health disorder as an adult, we see lower rates as well. Although both of these empirical strategies have their limitations, we may be concerned in both cases that causality are we adequately controlling for causality? Differences allows us to do perhaps a good job at addressing that causality. Survey data is better measuring a wider variety of mental health, and yet we may be concerned that there are other features that we don't observe and can't control for in our model. But the fact that both of these informative, if imperfect, estimation methods provide similar indications that school choice improves mental health increases our confidence that there's a causal effect between the two. These results, we've gotten a lot of press, in part because Corey's very good at working with the press, but in part because I think a lot of people right now, as public schools remain closed, as schools remain closed, but particularly public schools remain closed, people are concerned about the mental health of their kids. And it's not obvious a priori what would happen by closing schools, in part because we know that children's mental health can be better when school is out of session from previous research. But what we observe here, yes, so many public schools are still closed for in-person learning. Students are still expected to attend school, albeit virtually. And surveys from EdChoice, for example, when they ask parents if they want to send their children to school in person, many parents still prefer to have that virtual attendance option. They don't feel comfortable yet sending their child to in-person schooling because of the pandemic. A recent paper by Corey and another co-author, Makritis, looks at how much of the differences in which, these are metropolitan schools, which metropolitan public school districts have chosen to open in person, finds that the school districts that are choosing to open or choosing not to open, those not opening, that effect is driven by how powerful teachers' unions are in that city, not by how prevalent COVID rates or COVID deaths are in that city. So it suggests that there is some sort of political issue here about which schools are choosing to open and which public schools are not choosing to open. One advantage of having more school choice is that particularly in a situation like we face today, where the school you thought you'd signed up for, you'd moved to a school district thinking your child was going to attend a particular traditional public school that was offering schooling in a particular way. In many cases, that's no longer happening, at least because of the pandemic conditions, because they've shifted to virtual learning, or they've shifted to other modes of delivery or other modes of attendance and the like. The advantage in this case with choice programs is that other schools are private schools, charter schools, in particular these schools that are less subject to the political influence of teachers' unions, can provide options that fit families' needs and schedules. If families still want to keep their children home, certainly that's an option that charter schools and private schools are providing. But many more private schools in particular have opened for face-to-face schooling during the pandemic than has been true of traditional public schools. That responsiveness is likely to have even greater mental health effects on adolescents than what we're seeing in sort of normal before times, right? We're seeing effects of school choice improving adolescent mental health in normal times, in the 2000s and 1997, as these states are adopting their laws, in the 90s and the early 2000s. We're seeing that having more options has allowed adolescents to find schooling options that help them thrive. As COVID and as the pandemic has limited lots of options, schooling options for families, I suspect that those students who have schooling options that allow them to find schools offering choices that fit their family's needs are likely experiencing better mental health. Although I think that's probably the topic of another research paper that I hope Corey and I will get to. So I really appreciate your time. I hope you found this informative, and I hope you will bring your questions to the Q&A and that we can address them then. Thank you so much.